Hi friends, in this topic of ECG Basics, today I will talk about Trifascicular Block. First is a disclaimer, Caring Talks YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. The ECG diagnostic criteria for trifascicular block. The true trifascicular block, it refers to the presence of conduction delay in all the three fascicles below the AV node, that is right bundle branch block, left anterior fascicular block and left posterior fascicular block. It manifests as a bifascicular block and third degree AV block. One of the two ECG pattern is present, that is third degree AV block plus right bundle branch block plus left anterior fascicular block, or third degree AV block plus right bundle branch block plus left posterior fascicular block. The ventricular escape rhythm usually it arises from the region of either the left anterior or the left posterior fascicle distal to the site of the block, producing the QRS complexes with the appearance of the right bundle branch block plus either left posterior fascicular block or left anterior fascicular block respectively. The impending trifascicular block is other rare condition, and it includes normal sinus rhythm with alternating left bundle branch block and right bundle branch block. The right bundle branch block with alternating fascicular blocks on the beat to beat basis, and these herald impending failure of all the three fascicles and associated third degree AV blocks. Uh, Trifascicular block is also considered at times a clinical misnomer. It is uh, most commonly used clinically to describe a bifascicular block when it is associated with first degree AV block or second degree AV block. This term is inaccurate as the conduction delay results in PR interval prolongation that usually occurs in the AV node, not in the third remaining fascicles. There is no difference in the progression to complete heart block in patients with bifascicular block versus those with bifascicular block and associated first degree AV block or second degree Mobitz 1 block, 1% risk per day per year. The American Heart Association and American College of Cardiology Foundation and Heart Rhythm Society recommends against the use of term trifascicular block as it does not have a unique anatomical association and it does not accurately reflect the underlying anatomical disease progress. The clinical implications of trifascicular block are patient with true trifascicular block, that is associated third degree AV block, will require pacemaker insertion, and patient with bifascicular block and syncope or pre-syncope, they should be admitted for monitoring and likely the pacemaker insertion is required. It is a class 2 indication. Asymptomatic bifascicular block with first degree AV block is not an indication for pacing. It is a class 3 indication. The main causes of trifascicular block are similar to those of bifascicular block, and they are related to degeneration or conduction impairment in the fascicle below the AV node, and this includes ischemic heart disease in 40 to 60% of cases, structural heart disease in 50 to 80% cases, aortic stenosis, anterior MI, Lennox-Gastaut disease, congenital heart disease, hyperkalemia, and digoxin toxicity. In this ECG, we can see a true trifascicular block, that is right bundle branch block, left axis deviation, left anterior fascicular block, and third degree AV block. Incomplete trifascicular block is seen in this ECG. Here we can see bifascicular block for first degree AV block. Hence, right bundle branch block is seen, left axis deviation, or we can say left anterior fascicular block, and first degree AV block, and it is commonly referred as an incomplete trifascicular block. This represents the conducting disease of two fascicles with delayed conduction through either the AV node or the remaining third fascicle. It is not possible to differentiate between the two based on the ECG alone. So, incomplete trifascicular block is right bundle branch block, left anterior fascicular block, and first degree AV block. When we are no longer able to change a situation, we are challenged to change ourselves. It is said by Dr. Viktor E. Frankl. With this, I conclude my today's topic. Thank you. Keep learning.